If you're over 40 and things don't respond the way they used to, your body didn't change suddenly. It's been changing quietly for years. And if you've been telling yourself it's just stress, tiredness, or a bad phase, you may be ignoring signals your body has been sending for a very long time. Most men don't realize that the changes they notice now didn't start yesterday. They started much earlier than they think. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In this video, I'll help you understand how aging really affects male sexual health, not through sudden failure, but through gradual shifts that most men miss until much later. Sexual function in men depends on three systems working together: hormones, blood flow, and nerve signals. In your 20s and 30s, these systems operate with efficiency. Testosterone levels are higher, blood vessels are elastic, nerve responses are fast, and the body compensates easily for stress, poor sleep, or occasional excess. But after 40, something begins to change. Testosterone starts to decline slowly, usually around 1% per year. Blood vessels lose some flexibility. Nerve transmission becomes slightly slower. These are normal biological processes, not diseases. The problem is not that aging happens. The problem is that the body adapts so smoothly that most men continue living the same way: late nights, heavy meals, long work hours, without noticing that their margin for error is shrinking. By the time symptoms become obvious, the underlying changes may have been developing for 5, sometimes even 10 years. Testosterone does not crash overnight. It declines gradually, often without clear warning signs. You don't wake up one day feeling completely different. Instead, you may notice fewer morning erections, less spontaneous desire, or a sense that arousal requires more effort than it used to. Many men in India interpret this as work stress or family responsibility, and sometimes that plays a role. But often, hormonal changes are also part of the picture. The body can function with lower testosterone for years, but as levels continue to decline, the effects accumulate. Energy drops, mood changes, recovery slows, and sexual response becomes less consistent. What makes this concerning is not the decline itself, but how long it goes unrecognized. By the time many men seek help, testosterone has already been low for years, affecting not just sexual health, but muscle mass, bone density, and metabolic function. Blood flow is another critical factor. Sexual function depends entirely on circulation. When arousal occurs, blood vessels must relax and fill efficiently. This requires healthy, flexible vessels. After 40, especially in men with sedentary routines, high sugar intake, or metabolic stress, the inner lining of blood vessels gradually stiffens. This process, known as endothelial dysfunction, develops silently. There is no pain and no immediate symptom. What men often notice instead is that arousal takes longer, firmness is less reliable, or maintaining response requires more stimulation and focus than before. Many assume this is psychological, but very often, the cause is vascular. And because the change happens slowly, expectations adjust without awareness. The concern is that vascular changes affecting sexual function are often early markers of broader cardiovascular risk. What begins as inconsistent response can later reflect more serious health issues if ignored. The nervous system also plays a role. Arousal, sensation, and climax depend on fast communication between the brain and the body. With age, nerve conduction naturally slows. Sensitivity may decrease slightly. Pleasure may feel different or less intense. For some men, this shows up as delayed response or reduced sensation during intimacy. In India, where conversations about sexual health are often avoided, men rarely talk about these changes. They assume it's simply aging and learn to live with it. But neurological slowing, combined with hormonal and vascular changes, can significantly affect quality of life. While some aspects of neurological aging cannot be reversed, recognizing it early allows lifestyle adjustments that can slow further decline. Lifestyle plays a powerful role in how aging affects sexual health. Aging happens to every man, but lifestyle determines how quickly and how severely its effects appear. Many men in India over 40 face a combination of long working hours, high carbohydrate diets, low physical activity, chronic stress, and poor sleep. Each of these factors independently affects hormones, blood flow, and nerve health. Together, they accelerate the aging process. High blood sugar damages blood vessels. Lack of movement reduces circulation. Chronic stress raises cortisol, which suppresses testosterone. Poor sleep interferes with hormonal recovery. Two men of the same age can experience very different outcomes based on how they treat their bodies over time. The body does not respond to age on paper. It responds to daily habits repeated over years. When physical changes begin, many men react emotionally. Anxiety sets in. A single inconsistent experience is interpreted as permanent failure. Intimacy may be avoided to prevent embarrassment. Shame keeps men from seeking guidance. This psychological response worsens the physical issue. Stress constricts blood vessels, suppresses arousal, and reinforces the cycle. In Indian culture, where masculinity is often linked to sexual performance, this silence can be particularly harmful. Men suffer quietly, believing nothing can be done. But in many cases, awareness, lifestyle changes, and medical guidance can significantly improve outcomes. Aging does not mean inevitable decline. It means the body requires different support. If you recognize any of these patterns in yourself, it does not mean something is permanently wrong. These changes happen to most men. What matters is awareness. Understanding how your body is changing removes fear and opens the door to better decisions. Many men improve their sexual health after 40 not by reversing aging, but by finally understanding what their body needs. Every body is different. The changes described here can have multiple causes, and not every symptom is due to aging alone. This content is educational and not a diagnosis. If you are experiencing persistent changes in sexual function, energy, mood, or physical health, speaking with a qualified healthcare provider is essential. So let me ask you this. Have you noticed gradual changes in your body over the past few years that you've been attributing to stress, but may actually be related to aging? If you're comfortable, share your experience in the comments. And if this video helped you understand your health more clearly, consider subscribing. In the next video, I'll explain how sleep quality directly affects testosterone production and sexual function, and why improving sleep may be one of the most powerful interventions men over 40 can make. I'll see you there.